Hello. The name of the Lord is a strong and a mighty. Good morning, good morning, good morning. It's a rainy Saturday morning. It's not easy to wake up and come up here. So I just want to say thank you all for making it up here. I'll just share a quick word of prayer before I start. Father, Lord, we just want to thank you and bless you for this day. We thank you for looking after us throughout this whole week that this Saturday have come to meet us alive and kicking. We just want to say thank you, Father. Lord, we commit the program into your hands, that you would take absolute control over the program and help each and everyone participating to acquire the knowledge that they intend to have today. This we ask in Jesus' name we pray. Amen. So my question to you is, do you know what the retirement age is? Yes. Now we have our retirement age at 65. Now this information here, and first of all, I just my thanks to our other supporters, which is Houston Spine Institute, Express Pharmacy, and then the Ghana Association of Houston. We really appreciate you all supporting us. So back to the agenda for the day. I'm just going to briefly explain to you what Medicare is all about. Um, I did add a tad bit of Medicaid, but I have a lady here that actually uh, will talk just about 2 minutes on Medicaid. Um, so when we say original Medicare, what do you understand by it? Original Medicare is Part A and Part B. Um, Part A covers hospitalization. You don't pay for it because you or your spouse paid Medicare taxes when you were working. So that allows you to get a premium-free Part A um, Medicare. But there are others too that have to pay for it because they don't meet that criteria. There is also the Part B, which covers medical insurance like doctors, specialists, outpatient services. And with the Part B, you must continue to pay the Part B premium. Those premiums are typically set by Medicare. Original Medicare does not cover prescription drugs or routine dental, vision, or um, hearing, hearing benefits. So you always have to get that attached to that original Medicare. There's also what we call the coordination of benefits. If you have Medicare and other health insurance, like maybe a group health insurance, they're gonna coordinate and see who is going to pay first and who is going to pay second. So they are both payers. One is a primary payer, and then the other is a secondary payer. So the primary payer basically just pays up to the maximum of the benefit it's allowing you, and then the secondary payer takes it up from there. Um, any questions so far? Okay, so we're gonna move a little bit into the details of original Medicare. Let's see. Okay. Now, before you turn 65, you may apply for Medicare from Social Security. Um, you don't do that through Medicare.gov. You have to talk to Social Security about signing up for original Medicare. Um, and you can apply for it at least 4 months before you turn 65, um, or when you turn 65, the month that you turn 65. And Part B, you actually have to sign up for the Part B when you turn 65. Okay. Some people automatically get the Part A, like they just get signed up for it, and that's because they are already receiving Social Security benefits. So you don't have to do anything when your time is up, which we call if whenever you're eligible, you just Social Security just automatically signs you up. But if you're not collecting Social Security before then you have to, manually call them or go online and sign up for it. And also after you turn 65, you have, depending on your work situation, if you have health coverage through your employer, you may want to also wait to sign up for Medicare. All right. So I'll move on over to my next slide, which is Part C. So Initially, we talked about Part A, we talked about Part B, and now we're talking about Part C. And this Part C, it's also referred to as medical advantage, um, medical advantage, MAPD or medical advantage, sorry. Um, Now, Medicare Advantage Plan, which is also the Part C, is another way to get your Part A and Part B coverage. So I'm sure someone will ask, so do I still have to sign up for original Medicare, which is the Part A and B? Yes, you have to. If you don't, you get a penalty for not signing up for it. Now, the Medicare Advantage is sort of like a supplement to the original Medicare. So, original Medicare doesn't typically have prescription drugs or, dental, vision, and hearing benefits. So, this is where Medicare Advantage comes in, which is the Part C. They help to bridge that gap that you don't get from original Medicare. Now, with a Medicare Advantage, excuse me, you hear people say my Part C Medicare Advantage or MAPD. That's Medicare Advantage prescription drug. They have prescription plans in there, embedded in the Medicare Advantage plans. And we do have, they typically have vision, hearing, and vision, hearing, and what? Dental. Yes. The coverage may not be enough, but it kind of is enough for preventative um, dental, vision, and hearing. Now, there's what we call deductible, co-payment, maximum out of limit. I'm sure a lot of us are familiar with this because we already have health insurance one way or the other. Now, when they say a deductible, what do you mean? So a deductible is the amount that you must pay for your healthcare or prescription drugs before your health plan comes in to support. Okay? Sometimes you go to the hospital and they say you have to pay this amount. You be like, I have health insurance. Yes, you do, but you haven't met your deductible, and that's how come you have to pay. And everything that you pay that's coming out of your pocket is what we call your out-of-pocket limit. Okay? Now, each plans typically have like a yearly limit on what you pay out of your pocket. Once, okay, 1 second. Okay, sorry about that. That was a little technical error there. So I'm just gonna take this up again. Did anybody miss what I said? Okay, so we're just gonna continue. Now, co-insurance. No, we were on the maximum out of pocket. So plans typically have a yearly limit on what you pay out of your pocket for services for the Part A and Part B. Once you reach your plan's maximum out of pocket, you pay nothing for Part A and then Part B services. Okay? There's also what we call co-insurance. Co-insurance is usually like a percentage, like maybe 20% that you pay whenever you get medical services. And there's also what we call co-payments. These are things that we hear a lot, but sometimes we don't really take our time to understand what do you mean. You just pay. But co-payment is actually an amount you may be required to pay as your share of the cost for benefits you receive. Now, why am I describing all of these? This is because these are some of the features of the Medicare Advantage plans. Okay. Now, there's a simpler understanding of Medicare Advantage plans, and I just want to draw your attention to it. when you choose a Medicare Advantage plans, the premiums, okay, they are typically low. They can be as low as $0, okay? And they are locked in for a year. All right, and then they are usually referred to as bundled plans because of all these prescription, dental, vision, and hearing that they have embedded in there. And you also have to work within a network like HMO or PPO. And if you're not familiar with that, HMO simply means that you have to work within the provider network that they have with the plan. PPO is the same way, but the good side of the PPO is that you can go out of network. It's just that you will still pay a little bit more than if you are in network. The plan is going to support you when you have a PPO, but you will still pay something, unlike the HMO. Um, and then with the Medicare Advantage, there's always cost sharing, like co-pays, co-insurance, and all of that stuff. Any questions so far?
Yes, I do. So, what is the current the ranges you see for the out of pocket cost? What is the range right now? I know it will vary and increase with time.
Okay, so I have a question of the range you see for the maximum out of pocket. It truly depends. Um, so uh, right now I have to say right off, but I'm not representing any of the carriers or the insurers. But whenever you there is a tool that helps to estimate what your total out of pocket will be based on how your your back how would I say your experience has been. Let's say how many times you visit a doctor, a primary care doctor in a year, how many times you see a specialist. So they're gonna plug all of that in, and they'll kind of give you a rough estimate of how much you're going to pay for the year. So every individual person will have a different maximum out of pocket. Okay. Do we have any more questions? All right. So I will move over to what we refer to as the prescription drug plan. You're gonna hear part D. So far we've seen A, we've seen B, we've seen C, and now we're on D. Get the difference. When you hear D, just think about drugs. Yeah. So prescription drug plans, part D, it's also something you have to get once you reach Medicare age. And you can't say, I won't get it, because guess what? You will have a penalty for not getting it. Even if you don't have any prescriptions, you are healthy as a horse. Just sign up. There are plans that are out there that are like zero monthly dollars premium. I mean, you don't need it, but just so you don't fall into that penalty, the, the penalty of not signing up. Now, when do you have to enroll in a Part D? You enroll into the Part D as soon as you are also eligible. Um, there are a lot of plans out there that you can choose from. But when you go to Medicare.gov, they have a lot of plans also there that you can choose from. Now, if you do not sign up for the Part D when you are eligible to take it, you pay an extra 1% for each month you could have signed up for the Part D but didn't. And also, if you had creditable coverage, when we say creditable, you really want to check with your provider that's giving you, the plan that is giving you the prescription drug, to make sure maybe it's coming from an employer, like an employer group plan. you want to check and make sure it's creditable, because if it's not creditable, then it doesn't count. Then you end up paying the late enrollment fee of 1%. And with that 1%, they're going to add it to your monthly Part D premiums that you continue to pay. With the Part D, there's also what we call extra help. Extra help. The extra help program, it helps people with limited incomes and resources lower or cut, their Part D costs, to help with, prescription drugs and the deductibles, co-pays, and all of that. But you have to be eligible to take extra help. They call it extra help. You can find all of this information when you go to Medicare.gov. Extra help, that one specifically, you have to go through Social Security. Do we have any questions so far? Okay, we're moving on. The next topic we talk about is Medicare supplements. And trust me, a lot of people confuse themselves with Medicare Advantage and Medicare Supplement. Yes, they are both supplementing your original Medicare, but the names kind of makes a difference. Now, Medicare Supplement is also called Medigap. That's what you're going to hear a lot of people also say, Medigap. What is Medigap? It's also an extra insurance you can buy from a private health insurance company to help pay for your share of out-of-pocket costs. That kind of bridges the gap between what you're not getting from original Medicare. Now, with these Medigaps, you have to have a Part A and a Part B in order to sign up for a Medigap. And I think I missed that part, but that's the same for Medicare Advantage too. You have to have original Medicare Part A and B to sign up for the Medigap or Medicare Advantage. Now, for the enrollment period for Medigaps, you get like a 6-month Medigap open enrollment period, which starts the first month you have Medicare Part B and you are, 65 or older. Yeah. So during this time, you can enroll in any Medigap policy and get the insurance, and the insurance company cannot deny you coverage due to maybe a pre-existing health problems. Now, after this period, you may not be able to buy a Medigap policy, or it may cost you more. Well, you can actually buy it. It's just the premiums are going to be higher, and then you will have to go through like a medical underwriting. What is medical underwriting? They are like medical questions that they're going to ask. It's like they're going to really dig into your health background to know if, they want to insure you or not. Yeah, so you want to take advantage of that open enrollment period. Medical plans, their rates are not fixed. They can change anytime, maybe like once or twice in a year. And there are about 10 different types of plans you can choose from. But depending on where you live, will determine what plans are available for you to select from. Okay. When you're going to hear a lot of, guarantee issue, or GI. When you hear that, it just simply means that you don't have to go through a medical underwriting. Okay. Now, why would you want to go do a Medicare supplement or a Medicare Advantage? Okay. First of all, yes, the premiums are high. and they are subject to change at any time, typically once or twice a year. But the beauty about Medicare supplements is that you can use it everywhere. You are not restricted to be within a certain area or see a particular doctor. When you have Medicare supplement, any provider that takes Medicare, you should be able to use it with them. They should accept you. Now, then the second thing is that you usually want to go for a Medicare supplement because you can use it anywhere, and you can also use it when you see a lot of specialists. Yeah, you definitely want to go for Medicare supplement. If you travel a lot, this might also be an option for you. But you cannot have a Medicare Advantage plan and a Medicare supplement. You have to choose between them. Yeah. Now, Medicare supplement plans, they typically do not have prescription drug plans or dental or vision or hearing benefits. You have to get them separate. Okay? There are some special enrollment period and guaranteed issue rights, like when you lose your employer coverage, or maybe the plan that you are in terminated with it, like it's no fault of yours, it just terminated, or maybe the plan moved out of your service area. These are some of the special enrollment periods that you can actually have a guaranteed issue rights. And sometimes to some of the states, they do have additional guaranteed periods, like a birthday rule. It's really very specific to what state that you are in. Do I have any questions so far?
Yes. Question.
Okay, go ahead.
If you have a spouse that is not working, so you have a single income, how do you go about for all the parts that we have talked about so far, from part A, part B, C, and D, and then supplements?
Thank you for that. So when we started, I had mentioned this earlier, but I would just go back and say that so you can get a little bit of clarity on that. When for the part A, you become eligible for it, whether you or your spouse worked and paid Medicare taxes. So the partner that worked, they are the reason the partner that doesn't work will be eligible for a part A, and they will also be eligible to get their part B. Does that make sense? That's simply because you are a married couple. The other person that is not working is able to get it. It's just like when you have an employer group plan. You can have a plan that is able to cover you, your spouse, and your dependents. That's the same way with the Part A. Now, once you have the Part A, then yes, for the Part B, regardless whether you worked or not, you pay for it. And that one, there's no exception in that. Once you have your Part B, you can get your Part C, you can get your Part D. Did I answer your question, sir? Yes. Thank you. So before we move into the...
I'm sorry.
Okay.
What about the supplement and then the other one that you talked about? Medicare
Advantage.
supplement and then Medicare Advantage. Do you sign up for those separately, or those are also how do you call it? That's the question. How do you get those for the spouse that is not working?
Okay, thank you for that question. So he wants to know how you can get the Part C or the Medigap for a spouse that is not working. So once your spouse have become eligible for the Part A, whether it's premium free or not. So Part A, we have to understand that if you didn't work, let's say husband and wife didn't work, there are ways that you can still get the premium Part A, but you pay for it. But if you have worked, and there's some number of years that you have to meet according to Social Security. I think it's about 10 years of work. If you have achieved that and you are eligible, then automatically your spouse that is not working also becomes eligible, and then she's able to, or he's able to sign up for it. Now, once you have your Part A, you pay, you sign up for your Part B, but Part B, you will have to pay the premiums. As long as you have a Part A and a Part B, then you are able to get a Part C and or a Medigap. Okay? Now, with the Part D, whether you want to go the route of a Medicare Advantage or a Medigap, you have to sign up for it. So just to reiterate what I just said, when you have original Medicare Part A and B, you can sign up for Medicare Advantage Part C or a Medigap. No one is stopping you from doing that. Some people can just choose to just have just the original Medicare and the Part D, and they are good because they don't have a lot of, health issues where they have to see doctors. But of course, as you're growing, this becomes a necessity, even if it's just preventative. Yeah. So to answer your question, yes, once you have original Part A and B, you are able to sign up for a Part C and a Medigap plan. Well, I would say and or a Medigap. You can't have both of them. Yes.
Okay. So with those ones, you typically have to pay the premium separately for both spouses, correct?
That is correct. That is correct, yes. So if you are getting the Part A premium free, so basically you're paying Part B premium plus the premium of any Medicare Advantage you take or a Medigap plan that you take. Did that answer your question, sir? Okay, awesome.
Yes.
Okay, thank you. So let me see how we're doing with time. The next slide I have for you would be a little bit more comprehensive. So we can take maybe a 5 or 10 minute break, and then we will come back and finish our topic for today.
Hallelujah. Rakatonia, Okami hoa kwenye nem, shibibi oshemanem, okume kumina mamyo, anyasa kameyade. Okami hoa kwenye nem, shibibi oshemanem, okume kumina mamyo, anyasa kameyade. Okami hoa kwenye nem. Oh, Shemanem. Oh, come home. Mishi Bibi. Oh, come home. Oh, come home. Oh, come home. Oh, Menshano, Kameyate. Hey, Menshano. Mesha jinkwa kameyede. Odimeni, odimechi. Mesha jinkwa kameyede. Mesha kameyede. Mesha kameyede. Odimenim, no dimechi. Menshano. Menshano, kameyete. Menshano, kameyete. Menshajinkwa kameyete. Hey, odimenim, no dimechi. Jinkwea, Menshano, Kameyete. Ujimenino di Mechi. Oh, Menshano, Kameyete. Menshano, Kameyete. Hey, Menshano, Kameyete. Odimenino di Mechi. Hallelujah.
Thousand generations falling down in worship to sing the song of ages to the Lamb. And all who
Come on, put your hands together for Jesus. Put your hands together for Jesus. Put your hands together. Put your hands together. Sorry, if you're a wolf. Ordini mojano, apepaya bonina. I'm a meneo, abeye okratia safe. Oh, you know what? Let's do it together. Tiasasa, menewo ya dana sida. Yesu Christo, sorry if you're a wolf. Ordini mojano, apepaya boninina. Amma meneo, abeye okratia safe. Tiasasa, menewo ya dana sidana. Anka menewo, anka Nasuanam, Achikwa Yesu, sorry and nunti. Amma menewo, amma ene. Yesu so yesebi, tisasaya dana sidana. Anka menewo, anka Amma mene will say, Amma ene, Esusu yesebi, tisasaya dana Amma mene wo, Amma mene wo, Amma ene, Esusu yesebi, tisasaya dana Now, Jake, sorry, how no by me so Mami ninkugu wone nimu Money who say Yes soon you come in pepipia Hey so anyhow neba me so dia Our ball from the kukanye me Yo way to me baby do you believe that? So they how no ba me so Mami ninkugu wone nimu Money who say Yes soon you come in pepipia Hey so anyhow no so anyhow no Yo way to me baby oh to me baby to me baby Yo way to me baby to me oh to me baby to me baby Yo way to me baby oh to me baby to me baby Yo way to me baby to me baby to me baby Yo way to me baby oh to me baby to me baby Yo way to me baby Jimmy oh to me baby to me baby Yo way and I know most of you love this part. Are you ready? One, go. Sorry ne haba me so my boss kika Jimmy and my mini kuku on and in a jay money who say this will come in baby bia come on Yo way to me baby can we do it one more time 1 2 go When you stand against any trials, which shatters all your dreams and smile, and your footsteps are fully crushed, do not fear, for God is in control. I take it one more time. When you stand against any trials, which shatters all your dreams and smile, and your footsteps are fully crushed. Do not fear, for God is in control. He is the Lord, He is the Lord. Is there anything too hard for Him? He is the Lord. He has said it, and surely He will do. Hold on to your faith, your confessions, all the days of your life, and you will see the hand of the Lord in your life. He is the Lord. Is there anything too hard for Him? He is the Lord. He has said it, and surely He'll do. Hold on to your faith, your confessions, all the days of your life, and you will see the hand of the Lord in your life. He can do it. He can do it. Do it. Get it for you. Far more than you can think that He will ever do. He ever do. He can do it. Do it. Do it. Do it. Get it for you. You and I say. Far more than you can think that He will ever do. He can do it. He can do it. Do it. Get it for you. Far more than you can think that He will ever do. He can do it. He can do it. Do it. Do it. Do it. Get it for you. Far more than you can think. Put your hands together. Come on. Here we go. Here we go. Here we go. Here we go. One more time. Say. Onyankopon, why ya dikase? Amadasama, adikasia, hanunesa, odi Yesu adomye, wamaye nyankwa, eniye. Onyankopon, why ya dikase? Amadasama, adikasia, hanunesa, odi Yesu adomye, yenya kweni ewie yanto se. For from Merati, Assassinina, Montonio Merati, Montojo, for from Merati, Monshirandi Dino, and Yonyam Sano, Mokani Quenchesam, Piramutiasi, Monshan and Nimunya, Amana Manina. Amasanyina dipo iradi yakasi asaye a unyame yonofo nyame 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 yonofo nyame yonofo nyame unyame yonofo.
Thank you all for coming back after the break. So we're just going to continue from where we left off. before I go into my other slide, there was one thing that I just wanted to make sure that everybody also knew, that if you had a disability, you may be also eligible to get Medicare earlier. The disability we're talking about, of course, you have to find out through Social Security to see if that's an eligible disability. They determine all that. There's also the end stage renal disease. And then also if you have ALS. ALS is also sometimes called the Lou Gehrig's disease. So if you have some of these, you may also be able to sign up to get Medicare earlier. So now we're going to dive into the enrollment periods. If you have maybe a partner or a parent that you're living with that are around the Medicare age, which is 65, sometimes you're gonna if they are in the system, they have Social Security, they're gonna start getting those booklets. They'll be sending them to whoever is eligible for you to start looking out and understanding, what you're about to get into. Yeah, if you miss those booklets, if you are tech savvy, you can also go to Medicare.gov or go to Social Security, SSA.gov, to learn more about how you can sign up for the original Medicare. Now, when we say initial enrollment period, what do we mean by that? So it's usually referred to IEP. IEP, you hear it a lot. It's a 7-month period that begins 3 months before the month you turn 65. The month you turn 65 and 3 months after you turn 65. So for someone under 65 who becomes entitled to Medicare based on disability, then your entitlement begins the 25th month of your disability benefit entitlement. Yes, I knew someone would say to say that again. So let's say you've been on disability. I think the disability part is the part that gets people. Let's say you've been on disability for a while. On the 25th month, which is, so it's about 2 years and a month. So that 25th month is when you become eligible to take Medicare. Any questions?
So, the 25th month that you're talking about, is it the very day the person was declared disabled? Like 25 months after, before he's eligible for Medicaid? Is that what you are saying?
That is correct. And thank you for that question. So when you become disabled and you're collecting Social Security, you are registered in Social Security system as being on disability. You are receiving Social Security benefits. Okay? Now the benefit is different from getting Medicare. So if you've been on that benefit for 24 months, the 25th month, that's when you become eligible to take Medicare. That makes sense?
It does.
Thank you.
Why the wait period, though?
That's a very good question that I think I want to ask Social Security. Yes, so for these individuals, their initial enrollment period begins 3 months before the 25th month of the disability. Excuse me. And the month of the 25th disability, and then 3 months after. So if you look at it, the month that you actually become eligible, you have 3 months before and 3 months after for you to get Medicare. So whether you are disabled or you are just, in your 60, you're getting to 65 years, you have that grace period, that 3 months before and after. So it's a total of 7 months that you have. All right. Now there is what we call the general enrollment period for Part A and Part B. The general enrollment period is a 3 months that takes place from January 1st through to March 31st of each year. That's when you sign up for the Medicare Part A and B. Aside that initial coverage, initial enrollment period. Okay. Any questions on that? Am I confusing somebody?
Yes, I do have a question. If your birth month is not within that 3 month, that quarter, the January to March, how then do you apply if you're September born, for example?
Thank you for that question. So remember, you already have that initial enrollment period. So regardless of whenever you have your birthday, you have that 7-month period. If you miss that 7-month period, then you have a chance to do it during the general enrollment period, which is every year between January 1st and March 31st. Yeah. So there are also certain situations when a person can also sign up for Part B and the premium Part A during a special enrollment period without paying a late enrollment penalty. Remember, we said earlier, whenever you are eligible and you don't sign up for it, because you can say, I don't need it because I'm healthy as a horse. But you pay for it later when you need it. It's not mandatory, but you are required to have it. Okay. So a special enrollment period is only available for a limited time. When you have that special enrollment period and you don't use it, then of course you have to wait for that general enrollment period. But the downside of it is that you might have to pay like a monthly late enrollment period if you miss your initial enrollment period and you miss that special enrollment period too. So yes, you are still able to sign up, but that general enrollment period allows you to sign up, but you're gonna get a cost that comes with it. Okay. And always, the coverage will begin the month after you enroll into any period. There's what we call the late enrollment penalty.
Does anyone who enroll gets approved, or are there situations where someone could be disqualified?
Yes. So there are what do you call it? The criteria that you meet to become Medicare eligible. So, for instance, for those that did not work, that do not have a spouse that they can rely on for them to become eligible, you must be like a citizen, or you have to be like a permanent resident and you have to like be in the country for I think 5 years or more. Yeah. So there are certain criteria that you have to meet in order for you to even have a premium Part A that you pay for. Does that answer your question? Thank you. So for the late enrollment penalty for the premium Part A, if you did not enroll in the premium part A when you were first eligible, then you will have to pay a higher monthly premium if you decide to enroll later. Now, that monthly premium for Part A may increase up to 10%. And then you, that person that you are enrolling with that late enrollment period, you will have to pay that higher premium for twice the number of years that you didn't sign up for. So, yes, I do see a hand up.
So, is it like as soon as you get 65, you are supposed to sign up for Medicaid, whether you like it or not?
Yes, so the caveat here is it's not mandatory, but then again, you have to have it. Because if you don't, eventually you're going to have to have it, and then you have that penalty of not signing up when you were eligible. So, for instance, for the Part A, typically when you have worked, you've met that, I think it's about 10 years of work. Social Security have that information, but I think 10 years or 40 quarters or something like that. When you have met that criteria, it's typically like a $0 that you don't pay any premiums on it. So why wouldn't you sign up for it? Yeah, just to be on the safe side. And then with the Part B, if you have like a employer group plan that you're on, sometimes if it's creditable, that's what I should say. If it's creditable, then you can hold off on your Part B until you lose your employer coverage. A lot of these employers, they hold up their retirees even when they've left the company, they retired. They still keep them in their group coverage for quite some time until they can't anymore, whatever the decision is. Yeah. But yeah, if you have that creditable coverage, then you can hold off on Part B. But once that coverage ends, you definitely want to sign up for Part B. And I think I'm going ahead of myself, but go ahead. I have a hand up.
So how do we know if your employer plan is creditable? What's the criteria for that?
You can check with your employer, maybe benefit center or something, or yeah. Just check with them to make sure that it's creditable. It's the same with the Part D. You want to make sure that if your employer group plan is giving you the Part D, which is the prescription drug plan, you want to make sure it's creditable before you decide that I'm not going to enroll in a Part D plan. So for that Part A, again, if you do not enroll at the time that you're eligible for, your Part A may increase up to 10%. And then you will have to pay that higher premium twice the number of years that you didn't sign up for. So if you didn't sign up for like a year, you're going to pay the penalty for Part A for 2 years. Yeah. So if you just keep calculating, like if I didn't sign up for 2 years, that means you're going to pay for 4 years. Yeah. 10% increase. And you don't know the price now till you get to that age and they give you the price. Everything is expensive. Yeah.
So if, let's say I don't sign up early and I realize I have to pay for so many years and it's just too much, can I just decide just not to have it? Or am I required? Can I just, you know what, I'll pay for my expenses whenever the need arises. I'm not going through this.
I think you answered your own question. Yes, if you want to pay out of pocket for all your old age health costs, go ahead.
I just an experience with my mother-in-law. So she had worked here for about 17 years before returning to Ghana. And when she had signed up for Social Security, she just got the Part A, I believe. Not even the Part B. And after 3 years, she came back for glaucoma surgery. And so we had to go back and then sign up for Part B. Because she had not signed up, I think 3 years, she started paying higher than what she would have paid if she had signed up immediately, because we didn't think about the fact that, I mean, she would have had to come back for an eye surgery or anything like that. So we're like, she's fine with the Part A. But then it was when she went to see the doctor and they told them that, hey, okay, it would be cheaper if you go for Medicare Part B. And then when we went there, that's when they told us that because you did not apply for it earlier, now you have to pay more. And so, well, we didn't have any choice because it was way cheaper to do that than to. So, yeah, that's what we did.
Thank you, Mr. Inyo. So he actually even went ahead of, I was going to go into Part B. Part B is a serious issue. Part A, at least you just pay, twice the year that you missed. Part B is forever. You miss it, you pay till thy kingdom come. Yeah. So I have another question.
So is what are the difference between the benefit of Part A? Maybe you have already mentioned it. I wasn't here. What is the difference between Part A and Part B? Because something is forever, something is for a period. Why?
Okay. So, and to clarify your question, why do you have to have both? Okay. So the original Medicare, you have to have both of them. The Part A is for hospitalization, like when you get hospitalized, okay? And then the Part B is for its medical insurance, like when you go see doctors, specialists, or outpatient services. Yeah, so that is why you need both of them. Part A alone would not help you. You need both. And just because he said he was not here, I'm just going to throw in this part of it. Now, the original Part A and B does not cover everything, like dental, vision, and hearing. But that's where the Medicare Part C, and then, you either choose either Part C, which is Medicare Advantage, or you choose a Medigap, which is also referred to as Medicare Supplement. Those kind of go to supplement the Part A and B that you originally have. So basically, they are helping you with your medical costs by signing up for that extra insurance. I have another question.
So it looks like it's very easy to miss the application deadline. I didn't even know there was a deadline until I'm hearing you talk about it right now. I just thought you need it, you go for it. So that being said, we can easily forget. Is there a reminder, like, will the government send you letters? Is your doctor supposed to let you know, hey, you are getting to this age? Are the medical providers supposed to remind you of your application when you are getting close to that particular age? Or how is one supposed to just know if you don't have the information?
Thank you very much. I would say right off, but your doctor is not obligated to tell you to go sign up. They just want you to pay for the services they give to you, okay? But as I said earlier, when you are nearing the age, what we call the initial enrollment period, you're going to have a lot of stuff coming to you from Medicare and Social Security. They're kind of alerting you. Unless you're like me, that I check my mail like twice a month, yeah, you're going to miss it. Yeah. So they will keep reminding you. So you just have to pay attention to it. And then you can also go to, Social Security and sign up for it. But the only thing is that you're talking about the reminders, the only way will be those guides that they send to you. Yeah. If you pay attention enough, then you will catch it. Yeah. Did that answer your question?
Yeah.
Okay.
Okay, my question is the premium across board?
The premium,
Or some pay more than others?
the premium for Medicare Part A and B, it's across board the same. Medicare sets the price. Yeah. So I haven't checked the Part A price because, but I hear this year was like 185. Next year, it's projected to go to about 288 monthly. Yeah. And if you are like 50 now and you're going to get to Medicare age in about 15 years, just think about it. Yeah. But, they set those prices. They could go down, they could go up. That's up to Medicare. But they set those premiums.
So we'll be paying 300 out of the small money that Social Security will be giving us. We'll be paying.
And the fun part of this premium payment is that you can set up automatic payment for it to be deducted from your Social Security. So if you worked enough to get a Social Security at retirement age, hopefully the retirement money that you're getting is good enough to cover those premium costs. Then you are left with 700. Yes. Okay, did I answer your question, sir?
Yeah, it's sad that because I've made arrangements of how much I'm going to spend already. I didn't know I have to pay 300 for Medicare.
Okay. So that was an interesting.
I need a third.
Okay, one more
third
question.
job
Yes.
because, you see, I know how much I'll be getting from Social Security, and I made my calculation. Or I did not have to pay 300 for Medicare. I thought that thing was free.
No, the premium part A can be free for you if you meet up the criteria of the free premiums. Typically, the part A premiums can be free if you have worked. And again, I would say check with Social Security, but I think you must have worked like 10 years or must have met maybe I think 40 quarters or something like that. But you can check that. And if you are eligible to get a premium-free Part A, that's great news. But the Part B, regardless that you work or not, you have to pay the Part B premium.
I have a question.
Okay, go ahead.
So if we are going to pay, what is that deduction in our pay check every pay cycle? Like they deduct something for Medicare. So why am I paying for Medicare and then when I reach retirement I have to pay for Medicare again?
That's a very good question. So she's asking why she's paying for Medicare taxes and she has to pay for Medicare again. So the premium Part A, the free one, that's what you get for paying Medicare taxes. Well, someone said you're not paying. So it's like you have paid ahead of time. That's what maybe I will put it. And that is why you're getting that one for free. Supposedly free. The B, so that is just, a projected amount for next year. But you do know that there is a premium that you have to pay for the Part B.
But it looks like the Part B is very important because that's the hospital, the actual hospital.
The Part A is the hospitalization.
That is if I go and sleep there.
Yes.
But if I have to pay for
the Part B is for medical.
It's just like the one we have right now.
Yes, like if you have to see doctors, specialists, or if you have outpatient services.
So basically, yeah. So basically, we need it. Mm-hmm. So now we need 300 out of our check. That's good news.
So my point is,
okay.
I know that there's imbalance in here. I know this is not your question, but if you happen to have the chance to ask any of them, because when they are taking Social Security and Medicare, it depends on how much you are taking. Mm-hmm. Some people are paying more, others are paying less. So why the imbalance in here, whilst the premium is across board?
I would definitely say take that question up to Social Security. Yes, because since they make those decisions, yeah, you have to maybe they will probably give you things that they look out for. Um, so the life in itself is not the same for everybody. And yes, you may be paying more and you think that you shouldn't be paying anymore when you are older, but how about the other person? Yeah. These institutions are meant for everybody, regardless of whether you have money or not. So now that we talked about the part A and part B late enrollment penalty, so just understand that too. For the late enrollment penalty for part A, you're just going to pay twice the number of years that you have missed. But part B, if you missed it, you're going to pay as long as you have that Medicare. And it's 10% above the premium. So the gentleman that asked of the amount, if you want to avoid extra amount, yeah, you just have to do it whenever it's time. There is also something that Social Security has, which is called IRMAA. It's called Income Related Monthly Adjustment Amount. So with this one, individuals and married couples with an income over a certain limit, they must pay a higher premium. They must pay a higher premium for Part B and an extra amount for Part D coverage in addition to their Part D plan premium. So that additional amount is what is called income-related monthly adjustment. But it's about less than 5% of people that, get affected with that. Because, when you retire, right? But, of course, nowadays you retire and then you still keep going. All right. Yes, there's a question.
So, if somebody retire early, is it entitled to this benefit? If, like, say, maybe 55, you think you are done with corporate America, are you still entitled to this benefit, or you are out?
You are entitled to it, but does not mean that you have met the age for you to get it. Unless when you retired at 55, you retired on disability, then you will be you become eligible for it. But that disability is going to be in terms of what Social Security thinks that you meet the criteria to become eligible. So you retire at 55, that means you're a rich man. But then you have to wait 65 before you can enroll in Medicare.
So that means, if anything, if you retire at 55, you have to do your own private insurance until you reach.
That is correct. Sometimes, so some of the employers, they do give their retirees coverage. They still offer them, employer group plans. And so some of them stay on it until they actually reach the Medicare age. Now, if the employer, and that's where I also say check and make sure it's a creditable, plan that you're on. Because if it's not creditable, it means, well, you are 55, so you haven't reached it yet, so you won't have a penalty. But one thing you have to know is that if you're on Cobra is not creditable. Yeah.
It's a dangerous snake.
So if you retire at 55 and um, okay, someone said 55 is too low. So if you retire at 60 and you're getting Cobra, you are good until you get to 65. Then now you really have to sign up for Medicare. Yeah. What was the question?
Cobra then becomes ineffective, right?
Cobra is just helping you for your medical costs before you reach Medicare age. But once you reach the Medicare age, when you sign up for Medicare, you want to check to see if you can have both Cobra and Medicare at the same time. But I doubt that. Yeah. So that's where those Part C and the Medicare plans come in. So if you're paying for Cobra and it was helping you a lot, now you sign up for Medicare, you don't kind of have enough coverage, then you can sign up for a Part C to supplement what you don't get from the Part A and B. All right. So, some of these supplement plans that you get, some of them have like programs that can keep you in shape so you don't have to be going to the hospital, like fitness. Yeah, because, I mean, you're paying for it, but then again, they will wish you won't use it. Yeah. All right. And then we will get to the election periods. So there are, there's a question?
Yeah, I said we don't want the current one. You said election period. I said we don't want the current one.
This is election period and Medicare. Yes. So there are, I would say, 6 types of election periods, but it could be more depending on your individual situation. So there is what we call the initial enrollment period for the Part D we already talked about. When you age in, you become eligible and you have to sign up for it. And when I say aging, it means, you're getting to 65. You have that 3 months before 65, the month of your 65th birthday, and then 3 months after to make that election. And then there's also the initial coverage election period. This is when you can initially get a Medicare Advantage plan. Okay. That is also the same around when you first become 65. Yeah. And then there is what we call the annual coordinated election period, which is the period that we are currently in. It runs every year from October 15 through December 7. This period is for those that are already in Medicare to join, drop, or change plans and whatnot. Yeah. And then there is also the Medicare Advantage open enrollment period. The Medicare Advantage open enrollment period, I had said this before, is from January 1st to March 31st. It's also the same time for the general enrollment period for signing up for Part A and B. Yeah, it can get confusing. I can see some confused faces, but but yes, just know that January 1st and March 31st are important, you know, periods that you have to note, aside your initial enrollment periods. Now, for enrollment, there's a question.
There's a
You did mention there is a time frame to change or modify your benefits. So is it just like the current insurance? So if it's not time for modification, and maybe you have a particular ailment that needs a particular need, do you have to wait till the modification time, or can you just change your plan anywhere, even though it's for the need? Or like, is it like a regular insurance right now where you can only modify it
At a certain period.
period?
That's how that works too. So if something comes out of the blue, of course, you do have your current coverage in there. For any medical, excuse me, services you're getting for that new disease that came up, the plan may cover it, maybe may not cover it all, but that's where you have your current plan in place for. Yeah.
there's a question online.
Okay.
It says, "How can the new government retirement age affect Medicare?" She said
I
Medicaid,
didn't.
but I think it's more of Medicare.
I'm not hearing your question.
How can the new government's retirement age affect Medicare?
Affect Medicare.
Yeah, I'm not sure. Is there a new retirement?
If I can
age?
get clarity on that. The retirement
There's
age
a
is
proposed
okay.
new retirement age, which would be like 70 or so. So when that is implemented, the people that are even nearing 65 that are heading to retirement, how is it going to impact them? I think this is government question, right?
Yeah. But it looks like it's a question that when we get to that crossroads, we will cross with Social Security and Medicare. Because these are all like, federally regulated stuff. So, especially Social Security stuff. If so, when you retire, you're getting benefits from Social Security. So if they say you have to retire 70 years in order to get Social Security benefits, then so be it. But yeah, you might want to dig for more information from Social Security on that. But this is a future or a projected, we don't have it yet. For now, we just know it's 65. Yeah. Any questions? Okay. So the next one is for the enrollment into the Medicare supplement, or what we also refer to as Medigap. So under federal law, you get a 6-month Medigap enrollment period. It starts the first month you have Medicare Part B and you are 65 years or older. Now, the reason for this is because the Medicare supplement plans, you have to go through a medical underwriting if you are not guaranteed issue. So you have that open enrollment given to you for you to make a decision to sign up with a Medigap or Medicare supplement plan. Medicare Advantage, you don't go through medical underwriting. But for you to get the Medigap plan, which in this case, Medigap plans are very flexible. They allow you to move around. Sometimes they even have foreign travel, benefits in there. Yeah. So, yeah, because of how they allow you that freedom, they have to check you and make sure that, yeah, you're good for them to insure you. But you also have the advantage of that 6-month period from when you sign up for your Part B or when you turn 65 to get that. After that period and you sign up, then guess what? I'm going to dig information about your health background. Make sure if I can insure you or not. Yeah.
If you sign up for A and B and then you realize that the bills are Then the gap will have to.
The gap supplements it kind of like you said, the gap. So whatever gap that original Medicare is not filling in, the gap fills it up for you. Yeah.
So after all this payment, they still have loopholes somewhere that you need to fill, right? This is unfair.
Okay. Any more questions?
I missed the medical advantage. Why is this advantage?
So after your original Medicare Part A and B, you have two options to choose from. You have the Part C, which is also called Medicare Advantage, or Medicare Supplement, which is also referred to as Medigap. So those are, even though one of them is called Medicare Supplement, but those two plans are the supplement plans for original Medicare.
So the advantage is not giving you any advantage.
Well, I think we had even stated the advantages of the Medicare Advantage. And I can briefly go over that for you. So, the Medicare Advantage, they have really low premiums. It can range, I mean, it can be as low as $0. Okay. And when they fix the premiums is for a year. Okay. And then the second thing is that you have to work within a network like HMO or PPO, whichever one that you go for. Okay. The third thing about the Medicare Advantage plans is that you have like co-sharing, like co-pays, co-insurance. Yeah. And then the last thing about the Medicare Advantage is that they typically have prescription coverage, and then they have the dental, vision, and hearing also embedded in there. Typically, you see them in there. They may not be like an extensive coverage, but they do have that coverage. So if you're able to find one that fits your needs, and it's $0, hey, yeah, the sky is the limit.
You
But
have to sign up alongside the A and B.
that is correct. Yes.
And it also comes with premium.
Yes, but that is the Medicare Advantage. Yes, they do come with premiums, but the beauty about the Medicare Advantage is that they have really, really low premiums. Can be as low as $0. Okay. Now, comparatively to the Medigap, that give you that free, that liberty to go anywhere. Medigap plans are extremely high, like they are costly. But then you're paying for the freedom. Yeah.
Freedom is not free.
It's like when you have an insurance now and it's a PPO or HMO, you have to work within their network. So if you travel and you can't find anything that fits, you're going to pay out of pocket. Or sometimes you get these huge bills coming to you because your doctor or your whatever hospital you went to is out of network. Yeah. Madam Coordinator.
I have a question.
Okay, go ahead, sir.
So the question is the advantage Medicare, right? It gives you the flexibility to seek medical care anywhere. Is there a limit to the countries where you can receive Medicare and will be covered by this medical attention or medical services where this coverage will take care of it? Or it's like, what countries does it cover?
Thank you for that question. So, just to be clear, Medicare Advantage is different from Medicare Supplement. And the Medicare Supplement, that's the one that gives you that freedom that you are referring to. So I think that's where your question is centered. So depending, and again today I don't stand for any career. So depending on whatever career that you sign up with, you just check their plan details to see what it covers.
Which countries?
Yes. Yes.
It's going to limit to Mexico and England, and that's it.
Yeah, sometimes they have coverage for even when you are out of the United States. Yeah. So you just want to check with the.
It's limited, right? Based on what you are saying, it's like outside United, because I believe that if you can seek medical attention outside United States,
You can.
and then
They do have, they typically have coverages for emergencies outside of the United States. But again, you still have to check what the plan document or the summary of benefit is to see what it covers and what it does not. But those Medicare supplements, that's the beauty about them. They allow you to go anywhere. Yeah. So there's also open enrollment period for people. They call it open enrollment for institutionalized individuals. That is like for people that are going in and out of institutions, maybe like home health. How do they call it? Those facilities. Yeah. Skilled nursing facility. There you go. Yeah. They have, open enrollment period for them. For when you move in or when you move out, they give you that also flexibility. You have to be eligible for it though. Anyway. Do I have any more questions? Okay. I know when I was growing up in this country, I kind of struggled a lot to know the difference between Medicare and Medicaid. Today's topic was centered on Medicare, but just a brief description of what Medicaid is. Medicaid provides health coverage to, Americans that are eligible, but you have to be like low income. It's for low income, pregnant women, elderly adults, and people with disability. So if someone is, yeah. But these are usually, administered by states, even though it's the state and the federal that, yeah. But you want to check with your state to see how extensive it is for you. Yeah, because it's jointly funded by federal and state. I think if you remember some time back, Texas said they weren't expanding their Medicaid or something like that. Some states did and Texas didn't. Yeah. And then Medicaid is also a joint federal-state program that pays for medical assistance for individuals and families with low incomes and relatively few assets. As to how they define few assets, you can check with them. Now with the Medicaid, although pharmacy coverage is an optional benefit under the federal Medicare law, all states currently provide coverage for outpatient prescription drugs to, all categorically eligible individuals. Okay. I'm not going to go much into Medicaid because if you need more information, you can definitely go to medicaid.gov or you can call them and find out if you're eligible for Medicaid. Okay. Do I have any questions so far?
Just a comment. Thank you. This is great information. It's great information. And we need to advocate for people around us who are 60 plus that do not have this education.
Yeah, thank you. I appreciate your compliment. So hopefully every year, and I didn't say this from the beginning, but I am a licensed agent in health for Texas and some other states. But I'm gonna try every year so I can do this education for people to know. Because of course you don't want to ask somebody how old are you. Yes. So if you have the information ahead of time, trust me, some people they are in already enrolled in Medicare. They still don't understand what they are doing. Yeah. And you may be like a power of attorney for somebody, maybe a spouse. Maybe you yourself, you're not eligible for Medicare yet, so you don't know what's going on. But having this knowledge helps you to be able to make decisions for the people we care about. Yeah, as long as you have like a durable power of attorney that you can act for that person. Yeah. Yeah, people are not able to make their own healthcare decisions. They usually have a designated person. That person is called a power of attorney. Durable medical power of attorney. That's basically the word. So that means it's maybe court approved, signed and documented. Yeah. Because when you say you're a power of attorney or somebody, they're going to ask you for documentation. You can't just use word of mouth. Yeah. All right. We have any more questions?
What's the? Do you have a timeline on when you'll be organizing it, so we can get people in the community who are 60 plus? We specified that if you are 60 plus and you are here, you want to come, then we can support that initiative. If we have to drive them here to ask their questions, then we have very powerful men in the community who sponsor the drive, get them here by Uber, so that they will be here in person to ask their questions. So if you give a timeline, we can do that.
Thank you so much. So, if you follow the professional mentorship, we do have sessions throughout the year. But just for the purposes of the annual enrollment period, which is from October to December 15, I will look into doing this event every September, right before the period starts. Because for the aging, everybody has a different birthday, so I cannot use that. But I can do it like right before the period starts. Now, you did mention of bringing in people that are nearing the age and all that, but when we hold these programs, we want everybody. It doesn't matter your age to attend. It's not geared towards people nearing 65 only. And Medicare actually, yes, 60 or 60. Medicare actually prohibits that you limit the information to just the people that are nearing the age or they are around that age. It's like you are cherry picking. Yeah. Yes. And a part of, I am thinking a part of the reason they do that is because you don't know who is going to become eligible. You could be disabled and now you are eligible for it and you don't have the information, right? Or you are taking care of somebody that is eligible for Medicare and you don't have that information. So we don't limit it to just anybody who is aging. It's for everybody. Yeah. So people see their flyer and they go like, "Oh, I'm not old, so I'm not attending." It's okay, but that's not, our focus. Yeah. It's the entire community, even the youth. Your kids can attend because you don't know when mom or dad needs you to make those decisions for them. Yeah. Do we have any more questions?
So are you going to sponsor the drive for those who cannot drive anymore? Because most of the time, the elderly, they can't drive anymore. And they see these flyers and they're not tech savvy, so they cannot join online. So is that a way where we could solicit funds so we could get them here? Like,
So that would be maybe where I can talk to my sponsors to see how they can help with that. Because, for instance, ICGC Praise Temple is one of our big sponsors. They give us the venue and all the equipment. So I can't move my venue unless another person is sponsoring and can give me all, the things that I get here. Then I can go organize it there. Okay. And then secondly, if it's a drive problem, if it's something that we have to pull people, I mean, and forgive me for lack of words, it's not my responsibility to bring you here, right? But just because I'm in also the community, maybe it's something that we can do together from the Ghana Association of Houston, because they are also sponsors. They can also maybe look into how they can get people to get information like this. Yeah. Yeah. And then maybe what I can do on my part is, just whenever I have the opportunity in maybe a gathering, or maybe I can visit one or two churches, a few churches. I do try as much as I can to send it to people from different, dominations, because I want them to understand that it's not a church thing. It's information that you have to get. Yeah. All right. But thank you for that. So we will look into that with the sponsors. Yeah. Any more questions? All right. Well, I do want to say, first of all, thank you to God for making this event a success. I thank you, all my online viewers and listeners. My people that showed up in person here, I also appreciate you all. Even those that came in late, I do appreciate you. But my second appreciation goes out to my sponsors. This is ICGC Praise Temple, where we are hosting the event. And for Houston Spine Institute, Ghana Association of Houston, and Prime Express Pharmacy. Yes. I do want to say a big thank you to all of our sponsors for making this happen. Thank you, and follow us online. The professional mentorship are doing great things. Thank you, and you all have a beautiful day.